Okay, so our webinar should be live and we look like we're automatically recording.
Great. Welcome everybody, and thank you for attending our webinar today. It's a year since we started Conquest, and so we wanted to run this event for our participants and those who are interested to kind of talk about what we've learned from the past year and what our next steps are. So yeah, I'm Emily Nixon. I'm a postdoctoral research associate in the School of Biological Sciences, and I've been heading up Conquest, and I'll pass you over now to Ellen, who's going to do a brief introduction.
Hi everyone. Next slide, please. We've got one presentation and Emily's should be forwarding the slides. Yes, hi everyone. Thank you very much for attending today, and generally thank you very much for taking part over the last year. We know that it takes time and effort filling in your social contacts, but as a result, we've gathered some really useful data and been able to draw some important conclusions. And so it's really been fantastic having you all involved. And what we'd like to do today is really just give you a bit of a flavour of what we've been doing with the data and why we think it's interesting. My name's Ellen Brooks-Pollock and I'm a senior lecturer in the Bristol Vet School. And I've been heading up the Conquest since the beginning. So a brief plan for today is I'm going to give you a quick background of why we thought it would be useful this time last year when we were just starting Conquest. Then the team behind Conquest are going to introduce themselves. We're then going to tell you about some of the results that have come out of the Conquest survey. That's going to be Adam. Emily's going to tell you about some modelling that we've been doing. I'm going to talk about Conquest informing COVID-19 policy, and then at the end we'll talk a bit about how you've shaped the survey. We've got time for questions, so we'd really like any questions that you have or any thoughts that you'd have would be great. There's a Q&A box which you can use to ask questions throughout the presentation, and we'll answer them at the end in that section at the end. It's also possible to turn on captioning if you want to. I think you can all do that individually. Next slide, please, Emily. So just a brief overview of Conquest. Conquest was a name that we came up for as a short version of coronavirus questionnaire. As you know, it's an online survey accessible at this address, and we launched it this time last year in June 2020. It's for all University of Bristol staff and students. And as you know, if you've been taking it, we ask about COVID-19 symptoms, behaviour, if you have symptoms, and social contact patterns. It's completely anonymous, so we don't know who reported what. And yeah, that was purposeful from the start of the survey. Over the course of the past year, we've had 1,650 participants, and together you've contributed nearly 13,000 unique responses. So it's a really amazing contribution. Next slide, please, Emily. So why are social contact patterns important? You'll probably be aware that during the pandemic, we've been monitoring the R number. This is the latest R number for coronavirus in England. You can see it's 1.1 to 1.2. And this R number is really essential for understanding how well we're currently controlling coronavirus transmission. Next slide, please. This gives everyone's now familiar with the R number, but just a very quick explanation of it, the R number is the average number of secondary cases generated by an average case. So if the R number is 2, then if you start with one individual, then they will infect 2 other people. Those 2 other people will then infect 2 more people, so we'll have 4 infected people. Those 4 infected people will infect 2 people each, so we'll have 8, then 16, then 32, and you get this exponential growth in the number of cases. And we saw last March for coronavirus, we saw that the reproduction number, the R number, was about 3. Now, the R number can be measured by the change in the number of cases or deaths, but it also can be measured directly through contact patterns. Next slide, please, Emily. And pre-COVID, we know that on average, people spoke to between 10 and 12 people per day. So they were, on average, someone would have between 10 and 12 social contacts in a day. And these are just some pictures taken from an old contact survey that was run in 2010 of contact patterns of different types of people. So you can see the bottom left picture is a flight attendant. You can see there they are in the middle, the orange triangle. And these are all the contacts of people that they spoke to on the plane while they were at work. You can compare that with someone who's retired, who has relatively few household contacts. There's a school pupil who has contact with all the people in their class. And the last one is the example of social contacts of a firefighter. Next slide, please, Emily. So we want to use, so by measuring social contacts directly, we're able to have some understanding of how big the reproduction number is, or the R number is at the moment in the student population or in the university population. And these were the type of questions that we wanted to answer with Conquest. So there's a big gap in terms of really understanding what COVID-19 is like in young people, in young adults. So that's why we asked about symptoms. University students and staff are then generally quite poorly represented in other social contact surveys, and the university social network is potentially more contained than other social networks. So we were interested in what the social contact patterns are like within a university setting. Of course, we're all subject to social distancing measures at the moment, but how does that really work in a university setting? So how does it work in halls of residence? Does it work in lectures? And another example of these type of questions is really trying to understand how important face-to-face teaching is for transmission of COVID. Next slide, please. So now we're just going to briefly go round all the people who have been involved in Conquest over the last year. Here's a lovely mug shots of everybody. So I'm there at the bottom. Emily's introduced herself. Adam, are you going to, or who's going to introduce themselves next?
I can if you want. Okay,
great.
So I'm Adam Trickey. I am an infectious disease modeler and statistician. I previously worked in HIV, but due to COVID, I've transferred quite a bit of my time to COVID.
So hi, I'm Amy. I'm a postdoc in Bristol Vet School. I work in Ellen's group predominantly on bovine TB and zoonotic TB, but I've been working on COVID-19 over the last year, looking at social contact patterns in Conquest, ALSPAC, and also development of antibody assays.
Hi, I'm Sarah Denford. I'm a behavioural scientist and I've been working on COVID-related projects for the last 12 months or so.
I'm Hannah Christensen. I'm a senior lecturer in infectious disease modelling, looking a lot at meningococcal and vaccination, but transferred that over to looking at COVID and vaccination in young adults.
Hi there, my name's Gibran Hamani. I'm a genetic epidemiologist. I've been thinking about epidemiological patterns and disease severity of COVID.
Hi, I'm Josephine Walker, and Oh, look, I can start my video now. I'm a research fellow in infectious disease modeling and health economics, so I've been working a bit on some COVID projects on the side of all the other work as well.
So I think that's it. So now Adam's going to give you a brief overview of some of the results that have come out of the Conquest study data. Take it away, Adam.
All right, thank you. Can we have the next slide, please? So we're still collecting data and analysing it, but I'm going to run through two analyses that we've already done, which mostly use data from the autumn term. So the first one is from a paper that has been accepted and is in press, which looked at the contacts and behaviours of university students at the start of the academic year. So this was mostly using the data from the first few weeks of term. So we have the next slide, please. So as I presume a lot of you know, as you probably partook in the survey, so we collect data on demographics, COVID-19 symptoms, COVID-19 status, and reports of self-isolation. And from this, we managed to calculate whether participants reported having COVID in the 2 weeks prior to survey completion. And obviously, the key thing we asked about was the contacts on the previous day. So we split these into individual contacts, which were those which you spoke to in a one-on-one person situation, including those in your household or support bubble. Other contacts, which was, for example, working in a customer service role in the shop, and group contacts, which was large groups of individuals in the same setting, such as in lectures. Next slide, please. So for this paper, we included records from the 14th of September to the 1st of November, so to capture when students arrived back at university. And we used multiple responses per person where available. And we also included a comparative population of staff as well to see how behaviours compared between staff and students. So we weighted these analyses to make the data set more representative of the university student population in terms of gender and under/postgrad status, as we had a lot of females and also postgrads taking part. So I'm happy to go into further details about the methods in the questions section later on. Next slide, please. So we included 740 students, and this included 1,261 responses from students. And then for the comparative staff population, we included 433 staff with 1,655 records. So most students lived, well, not most, but the highest population group for household size was 2 to 3 for students. It's worth pointing out at this point that although you might associate students living in large halls, these halls were broken up into smaller bits at the beginning of term as one of the university policies. Next slide, please. So this slide shows that some behaviours and infection status of students split by study year. So what this really highlights is that most of the infections that we saw and the students with symptoms or that had to isolate were in the first year group. So that was those mostly living in these big halls, which I presume quite a lot of people are aware of. There was large amounts of students having to isolate, like mass isolations due to halls being closed. So this is reflected in these numbers, with the percentages declining for each of these statuses as study year increases. Next slide, please. So here we look at the overall contact numbers, as well as those split by contact type, and comparing students who reported isolating in the last week or not. So it's important to note here that we asked about isolation status in the previous week. So there's some students who said they had been isolating. At the point they're filling in their contacts may not be isolating any any longer. So you can see here that the contacts for those not isolating are higher than those isolating, which you'd expect. Those isolating still do have contacts, and it's just perhaps unsurprising because we know that students live in these large halls. So even when everybody in the halls is isolating, they'll still be in contact with each other. You can see that at the bottom, the percentage of contacts made at home increases for those not isolating compared to those isolating. So a much higher percentage of their contacts were made at home for those isolating. And we've also included here just the staff results as a comparison. And you can see actually that the results are generally not too dissimilar for the staff and the overall student group, although they are slightly lower overall. But there's a similar number of contacts made at home for both staff and students. Next slide, please. So this is the second paper we're going to talk about. So this one looked at the contact numbers for both staff and students over the various government guideline periods for COVID that were introduced. So this paper is currently under review. We're hoping it'll be accepted soon. And this used data from the start of the survey, from the 23rd of June, to when we cut off the data to do the analysis at the 25th of November. Next slide, please. So this looks at the weekly staff contacts so this shows the median and the mean. So the median is the orange blocks and the mean is the red line. So you can see that there's a very good correlation each week by the different rule periods, which are shown in different shades on the back of the graph. So just to clarify things, we have the post-lockdown period, which went from the 23rd of June to when a more lenient set of guidelines was implemented on the 4th of July. And then the next one, which we're calling the relaxed rules period, which was from the 4th of July to when the fourth set of guidelines were implemented, which was the 14th of September. And then the next period was the rule of six period, which was implemented from the 14th of September until the second lockdown, which was the 5th of November. And that's the last bit you can see in the darkest shading, which is just all second lockdown. So you can see that in the post-first lockdown period and the second lockdown, where rules were tighter, you have lower numbers of contacts. So next slide, please. So this is showing something similar for students. So this looks a bit more up and down. However, it's worth pointing out that most of the students we recruited were recruited at the beginning of October. So that's where the blue line is. And from then on, it looks pretty consistent. And as you can see, it is still very low numbers of contacts throughout. Next slide, please. So this is just looking at the contacts, the mean number of contacts for each lockdown period. I've highlighted the means for each period. As you can see, it's highest in the rule of six period for both the students and staff. And then it's lower in the other periods, with the lowest for staff being in the post-first lockdown period and the second lockdown period, and the lowest for students being the relaxed guidance period, but we had fewer students filling it in there. Next slide, please. This is just looking at the contact types by period, just comparing the rule of six period and the second lockdown period. And you can see for both staff and students, there's a big drop in contacts when the lockdown was introduced. And for the staff, this is driven by every contact type, so individual, group, and other, although there's less other contacts for staff. Whereas for students, the individual contact stays roughly the same, but the other two, the group and other contacts, drops quite a bit. So I think that's it for me. So I'll be passing over to Emily.
Hi, so I'm now going to be talking about how the Conquest data has been used in modelling. But first of all, I'm just going to do a quick comparison with a pre-pandemic contact survey. So these graphs were plotted by our master's student, Daniel Stocks, and we're looking at a contact survey here called Characterising Great Britain, and the reference for that is in the bottom left-hand corner of the slide. And we've plotted results here from those who reported to be affiliated with a university in that pre-pandemic contact survey, which is CGB, which took place about 10 years ago. And then that's in red, and then in pink are the results from Conquest. And in the left-hand graph, you can see that the number of contacts in Conquest consistently lower than in this pre-pandemic contact survey. But in the right-hand graphs, you can see that the contacts that were reported tended to be longer. So about 60% of respondents reported contacts that lasted more than an hour. And then also people tended to meet with the same other people. So it was more frequent with the same person more often than in the pre-pandemic contact survey. So that sort of makes sense because of the restrictions, we'd kind of expect there to be less contacts and people to be seeing the same people that they were all the time. But yeah, that's an interesting result. So now I'm going to be talking about 3 different models that our group have been using to answer different questions about COVID, and we've been using the Conquest data in these models. So the first model is a network model developed by our master's student, Daniel, that's been looking at contact tracing in universities. And the second model is one developed by Ellen, which is looking at different mitigations interventions in a university setting. And then the final one is a model developed by Jib, looking at pooling testing. So first of all, I'm just going to talk a bit about Daniel's modelling that he's been doing with the Conquest data. So just to give you a bit of a background about network modelling, in a network model, a node represents a person, edges represent contacts between people, and these can be weighted according to the duration of the contact. So that's an example of, we ask about how long you come into contact with someone. That's an example of how that data is really useful for us in modelling. And yeah, in a network, in an egocentric model, you have an ego, which would be kind of one respondent, for example, you responding to Conquest, and then the alters are the people that you reported to come into contact with. So we don't actually ask in Conquest about whether your contacts meet each other, apart from in the groups question. Whereas the pre-pandemic contact survey that I spoke about did ask that. So Daniel's used kind of the average result from that to try and estimate in his model what that would be for our Conquest data. And he's built lots of different egocentric networks to look at isolation and contact tracing. And then also he's built a bigger, large and connected social network, which includes a representation of the whole university population based on the results from the egocentric networks. And some initial findings that he's got are that contact tracing can reduce the physical spread of COVID to a greater extent when it is more transmissible, and also that it can prevent a greater proportion of asymptomatic transmission when COVID is more infectious. So now I'm just going to talk about a completely different kind of model that uses the Conquest data. So this is a stochastic model, which means that you'd run it lots of different times to get different results, and you'd look at the variation in the results, because in any kind of normal real life situation, the same people wouldn't necessarily get infected in exactly the same way every time. And it's called a compartmental model because individuals are divided into different groups according to disease status. So in this compartmental model, individuals in the university are characterized whether they're susceptible to COVID, latently infected, pre-symptomatic and infectious, asymptomatic and infectious, self-isolating, recovered and immune, or infected with symptoms. And there's a preprint that fully describes this model that I've put a reference in the bottom left-hand corner, and this is also in press. How is Conquest data used in this model? So within the model, there's 161 different groups based on school and year. So for example, year 1 School of Biological Sciences would be a group. So you can see in the right hand image here, this is actually showing information about who shares accommodation with who. So it's not actually Conquest data, but this just shows an example of the different groups that are within year 1. And so we use the Conquest data or contact data here to estimate the contact rate between each of these different groups. And we can split this by context, so the contacts that people have at home, at university, leisure or other, or travel. So again, that's why we ask you about where you meet your different contacts, because that's all really useful information to inform our modelling. So Ellen's used the model to look at different interventions which could help to mitigate the spread of COVID in universities, and I know she's going to be speaking a bit about that later. So finally, I also just wanted to say that the Conquest data has been used to estimate the probability of transmission events for an infected individual to infect others in the same living circle or elsewhere. And that's in Gibbs' paper, which the reference is here on the slide as well, so you can find out more about there. Now I'm going to pass over to Ellen, who's going to talk about how Conquest data has informed policy.
Thanks, Emily. Next slide, please. So we've all heard a lot about how science is included in the government at the moment. Boris Johnson, our Prime Minister, and then there's Patrick Vallance on the right here, who's the Chief Scientific Advisor, and Chris Whitty on the left, who's the Chief Medical Officer. They input scientific advice into the government's decision-making. And they chair the scientific advisory group for emergencies called SAGE, which is a group of scientists mainly from Public Health England and universities with knowledge of how infectious diseases spread. And then I contribute to a subgroup of SAGE, which is called the Scientific Pandemic Influenza Group on Modelling, called SPIEM, and it's really through SPIEM that the work with Conquest has been impacting on policy. Next slide, please. So this is some of the first work using Conquest that went to SPIEM, and so these were the results, or these are some of the figures that came out of the modelling that Emily was just showing. So before the academic term started last year, so over the summer, we simulated a range of possible scenarios for what COVID outbreaks might look like within the University of Bristol. And in particular, we found that first years were more likely to make up about a third of all infections, with the highest infection rates and getting infected early on in the academic term. And so these kind of scenario modelling for university outbreaks fed into the SAGE advice that went on reopening higher educations last summer. Next slide, please, Emily. We've also been doing some work more directly using Conquest for the Department for Education. In particular, they were very interested in the different numbers of contacts reported by individuals in different schools within Bristol. And here you can see the number of participants, that's the N column, for each of that participate in Conquest, and then their total numbers of contacts. So at the bottom you can see students in health sciences education, medical school, and cellular molecular medicine tended to have higher numbers of contacts than, for example, students in law, chemistry and policy studies who had lower numbers of contacts. Next slide, please, Emily. We were able to relate this to whether you had face-to-face teaching or not. So obviously medical students, vet students, dentists and student teachers were much more likely to carry on having face-to-face teaching during periods of lockdown. And we found that yes, face-to-face teaching did increase the number of contacts that a person reported. So for teaching block 1, we found that people with face-to-face teaching had on average 7.1 social contacts in a day, whereas people without face-to-face teaching had about 5 social contacts in a day. During teaching block 2, this was obviously when we had lockdown 2, and the number of contacts in both groups reduced, and people with face-to-face teaching then had on average about 6 contacts a day, whereas people without face-to-face teaching had just over 2 social contacts in a given day. And this was some of the results that was fed into SAGE about looking at the impact of face-to-face teaching on transmission of COVID. Next slide, please. Yeah, so I'm back to Emily now, who's going to talk a little bit about the work that we've done with you developing the survey.
Hi, and I think Sarah's going to be doing this section as well. So yes, some of you may be aware that we had been running some focus groups for students because we had a lower uptake from students in the survey generally. So we've been running these in May and June, and we've been having different groups for people who have and for those who haven't completed Conquest before. And the purpose of the groups was to find out why some students haven't taken part, how burdensome completing the survey is, and things that we could do to improve the survey. So Sarah's now going to talk about a bit the initial findings that we have from the focus groups.
Great, thank you, Emily. So one of the first things that we asked people were why they had been so willing to take part in quite a time-consuming survey and were able to do it on a regular basis. So they told us, students told us that they were really willing to complete the questionnaire because they thought it was important, they thought it was meaningful, and they wanted to help and do the right thing. So they thought it was something that they should be doing. And obviously they're researchers themselves, so they do really value research and kind of the impact of research. Students were also aware that there's been quite a lot of bad press about student populations, and so we're keen to provide some data that would actually change this perception. And 1 or 2 students used it as a kind of a way of procrastinating when they had a few minutes or were a bit bored. But even among those who were regularly completing the survey, there were times that they were not able to do so. So for example, if students were too busy during exam periods or holiday periods, then the rate of completion was a bit lower. They also stopped completing the survey or kind of a bit less willing to complete the survey when they felt the threat of COVID was a bit lower. Next slide, please, Emily. So pretty much everybody who didn't complete the survey said that they hadn't done so because they weren't aware of the survey, hadn't been asked to do so, but they would have completed it had they been aware of it and had they been asked to do so. They gave us a few pointers on the sorts of research that they would be willing to complete, and they said they would be very willing to complete a short survey, particularly if it's one-off, relatively easy to complete, but they would be put off by overly long or repetitive or complicated questions or research studies that required a lot of personal data. Next slide, please, Emily. Both those groups who were regular completers of the survey and those who had never completed the survey thought there were a few things that could possibly be made a bit clearer. So one of the first things that students questioned was whether or not the questionnaire had to be completed on the day it was sent or if it could be completed a couple of days late. And some students had missed a week or 2 because they hadn't been able to complete it on the day that it had been sent. Students also questioned because they received the reminder on the same day, They were concerned that it may not always be a typical day. It could be sent on a particularly quiet day and therefore not be representative of their true contact patterns. There was a bit of a lack of clarity around which contacts should be classed as an individual contact and which should be classed as a group contact. And people gave specific examples of this. So for example, where to put a housemate that they also worked with and so on. And they found this quite off-putting. If they didn't know where a contact should be included, it could be a bit frustrating and potentially could stop people from taking part. So students agreed that the more contacts that they had, the more difficult and problematic it would be to answer the question. And as lockdown measures relaxed and contacts increased, this became more of an issue. A couple of groups that had not completed the survey agreed that they would complete on average about 5 contacts before getting a bit bored. They disagreed on whether they would stop filling out the survey or just stop at 5. But either way, 5 was pretty much viewed as a maximum. And the more information that was requested about each contact, the fewer contacts they said they'd be willing to complete. But saying this, the majority of regular completers said that they had given honest answers to the questions and said this was largely because responses are anonymous. So if responses had not been anonymous, students would have been more cautious of being truthful for fear of getting into trouble, even though they hadn't done anything wrong. And in some cases, there were legitimate reasons for being in contact with a higher number of people, but they thought their responses could potentially be misinterpreted by the university because there wasn't space on the survey to explain themselves. And despite the fact that it was anonymous, some students discussed how they felt a bit guilty if they weren't keeping to government guidelines and worried that even though it's anonymous, it could possibly be able to identify them through their demographic information. So again, the more detail requested, the more anxious it made students. So in particular, students questioned the need to include information about faculties, but once the purpose of collecting this information was explained, the group said they would indeed be willing to provide the detailed information because if they understood why it was being collected, it would make them much more willing to provide it. Next slide, please, Emily. Sorry, the one after that as well. So next time, I think I missed a slide. So we then asked the group to tell us what they thought could be done to improve things. Those that hadn't seen the survey and weren't aware of the survey suggested that recruitment could be improved through the use of university emails or announcements on Blackboard, but thought it would be better to use personal contacts, so for example student reps or course tutors, as opposed to anonymous generic all school or university emails, because it's really easy to miss emails unless there's a kind of a really catchy title or the research seems really relevant. So again, really highlighting the importance of making it stand out from the rest of the emails that students are receiving. Some students suggested the use of WhatsApp or other platforms, but there were some concerns around potential security issues with clicking links on phones. So really highlighting the need for text messages or any other messages to come from a trusted and recognised source. The regular completers told us that the survey did take quite a long time to complete, and they thought this could be off-putting to some, but thought anything that could be done to make it quicker and easier to complete would be really useful. So participants thought it would be helpful if the survey remembered responses from previous completions, and particularly students that lived in large households and had to enter details of the same person each time, thought that would be really useful. Students also queried whether it would be possible to reduce the length and frequency that the survey needed to be completed. They would like it to be easier to complete on a phone and to reduce the repetitiveness of some of the sections. Although financial incentives were considered a good way to make survey completion more appealing, students were unclear on how to maximise the persuasiveness of this. And in the absence of a financial compensation, students thought personalised feedback would be really appreciated. So for example, some statistics presented at the start of the study about the data that they had submitted, so a summary of findings to date or a summary of their personal completion. And that would help them see the impact that their time spent completing the survey was having. Some of the students also said that they'd received the survey twice, and I think Emily's going to do a poll to see whether anybody else has received.
And we're going to do that later on now.
That's it from me, thank you.
Thanks everyone. So now we're going to have some time for questions. So thank you to those of you who've already posted some questions in the Q&A. If you have any more, then please post them now and we'll start answering the ones that have already come in. So I'll just hand over to Hannah, who's going to be managing this section.
Thanks, Emily. And yes, thanks for everyone that's put questions in the Q&A box. If anything sparks your thoughts going on, please do add them in. So the first one we're going to be answering is, out of interest, why was the survey not updated to include vaccination status? Emily, would you like to comment on that one?
Yeah, so that's a really good idea, and I think that would be something that would be really good to include in the survey soon. So thank you for that question. Each time that we want to update the survey, it's quite a long process. So we have to apply for ethics approval, and then we have our data manager who needs to rewrite the code for the survey in the system and change that. So we kind of try and do kind of rounds of changes in a group, and we are hoping to do a new round of changes soon now that we've got the results from the focus groups. So I think that would be really a great question to include now when in our next round of changes that we'd like to do.
Thanks, Emily. I think as well we're very mindful that our new student cohort, most of them won't have been offered the opportunity to have a vaccine until they start in the autumn anyway. So there may be some who have received a vaccine in those participating currently, but the majority won't have. So that's one of our key changes coming up for the autumn. Our next question was, I'm an outlier, a mature student age 69. I guess I could have potentially skewed the survey, being both student and retired. That was the first part of the question. So maybe Adam, you can respond to that. And the second part is about publications. I think we'll come to that later. Maybe Adam, would you like to respond to that data question?
So yes, so that would be an outlier, but it's not really an issue for the results, particularly because for our multivariable models, we would adjust for age and various other behaviours. So this will be taken into account of.
Thanks. Our further question. Hello, thanks for running the session. You're very welcome. Is there a risk that questionnaires underestimate the number of contacts? I can imagine this can be more of an issue if someone has a lot of contacts, either because they're ashamed to admit this or will get tired of data entry on the form. If this is the case, how do you adjust for that bias in your models? I wonder if Adam and then Emily might like to comment on that.
So I think there is a risk that these questionnaires underestimate the number of contacts. So possibly both because people won't want to fill in if they've got a lot of contacts, as you say, they're ashamed to admit it, or because they get tired of data entry. But also because we might not have a representative group of students, in that those more likely to fill out these surveys possibly or less likely to be going to bigger gatherings anyway. I suppose I'll let Emily answer the second bit.
Yeah, so just to agree with Adam that there could be, there's always risk of bias with these kinds of surveys, although we did have people report large numbers of contacts. Obviously it might not be representative of the amount of people that are having those large number of contacts, but we did have variation in the numbers that people are reporting. In terms of how you can adjust for that in modelling, I guess often you would look at a kind of range. You wouldn't necessarily just say, you wouldn't give an absolute value. So you look at a lot of the range of results and distribution of results to try and adjust for that. I don't know if Ellen wanted to add any more to what I've said.
Yeah, I agree with what Emily and Adam have said. I would just add that, I mean, one of the reasons why we included the group question was to really make it easier for people to report large number of contacts. We're also cross-checking the results between Conquest and previous surveys, but of course, people in previous surveys might have not not wanted to report high numbers of contacts as well. So, I mean, we're doing some kind of checks. Overall, if you look at the distribution of contacts, there's nothing to suggest that there's a discontinuity where people are not reporting particular sizes of contacts. But as Emily said, it's something that we try and adjust for in the modelling.
Thanks. Our next question asks about SAGE. So does SAGE interact at all with independent SAGE, the latter being very informative to many of us? Ellen, I wonder whether you want to take that one.
Yeah, so that's interesting. So, I mean, SAGE takes into account all scientific evidence, including anything generated by independent SAGE and anything else. There's obviously a huge wealth of scientific information that's coming out on COVID all the time. There is also some overlap. I think someone, Susan Mitchie on independent SAGE, is also on SPI-B. So via that route, things might feed more directly from independent SAGE into SAGE. So I think over the course of the pandemic, SAGE has become more open, and so the list of people who are contributing to SAGE is regularly updated and published. And it's not, SAGE isn't a closed group of scientists. People join as and when they have particular expertise in an area. So I don't necessarily see them as two completely separate things.
Thanks. We've got a comment now, really more than a question. The only problem with completing was where the language of the survey was irritating, but it didn't actually stop me. So I'm glad it didn't stop you. But Sarah, I wonder, given that you've been helping us with the focus groups, whether you'd like to comment on that.
Yeah, as Hannah said, really pleased that it didn't stop you from completing the survey. But we would be really interested to hear any feedback. So if you do have any specific feedback on the language, or what in particular you found irritating, then please do get in touch. We'd be really happy to hear from you.
Thanks. Okay, next question. So will Conquest be continuing in the future? And if so, is it going to be in the same way or differently? Ellen, would you like to take that one?
Thanks, Hannah. Thanks for the question. So we've just renewed the Conquest platform for another year. In particular, we're thinking about what will happen for the next academic year, 2021-2022. So we'd really like to capture that first term and see what happens. Obviously, things are a bit uncertain at the moment, how much face-to-face teaching there'll be, what the COVID situation will be. So it'll be really valuable to continue monitoring what's happening during the first academic term. So in terms of changes, we're very interested. It's been really useful running the focus groups on what people, what would make it easier to complete, because we don't want it to make the survey too onerous on people. So, with things we've been discussing are things like, should we run it monthly as opposed to weekly or fortnightly? And how would that change the balance of the amount of data that we get versus the fact that people might be more willing to participate? As another question asked, we're definitely interested in vaccine status and understanding exactly how vaccination impacts on behaviours and contact patterns and symptoms that people are reporting.
Thanks, Ellen. The next question's asking about sort of detail of things that we're asking. So the questionnaire asked for the age of the people we're in contact with. I wondered if this data is being used for anything in particular, or is it some sort of controls in the models? I wonder if Emily and Ellen would like to jump in on that one.
Well, first of all, I don't know if we really said this much, but the data from Conquest, well, we won't only just use that, it will be made, well, it has already been made available in an anonymous way where people have to apply for it, and then it will be provided to them in an anonymous format. But it can be used for all sorts of different kind of infectious disease modelling or other analysis that other groups or other people want to do. And age it can be a very important factor for that, and for COVID as well. It is because we know that different age groups have different levels of being asymptomatic, and obviously with the vaccination, different age groups are being vaccinated at different times. So age is a really important thing. I don't think we've done loads with it yet, apart from in Ellen's model. We might be doing a bit with that, but it's something that is always a really important piece of information to collect, I think. But I'll pass over to Ellen now as well.
Yeah, so the age of contacts is really critical in calculating what the R value is, because it's not just the number of contacts that you have, it's the type of contacts that your contacts have. And because age is a really good predictor of who meets whom, being able to have the ages of contacts means that we can build a more accurate picture of the reproduction number in universities, the R value in universities. So yeah, that's a important bit of information that we're collecting. As Emily said, we haven't done an enormous amount with the age of contacts at the moment, but we are using it for constructing these who meets who matrices.
Thanks. And the last question we've got at the moment. So did you find any links between infection and different types of contacts, for example, indoor, outdoor, long, short contacts? Adam, I wondered whether you'd like to respond to that.
So this is an interesting question that we've not looked at too much yet, but partly that's because we haven't really looked at the data since testing has been ramped up. So previously, most people who were reporting COVID were self-reporting their suspicion that they had it. Whereas now, because testing is available commonly, that if people are reporting it, they are likely to be tested as well. So we can probably now look at associations between testing positive. And amongst this, we can look at the types of prior contacts that people have had, including where they've had them, if they involve touch, etc.
Thanks, Adam. Okay, that's the end of all of our questions that we've got so far. Thanks for all your engagement. It's really nice to have some feedback live while we're doing these sort of things. I'm going to pass you over to Emily now.
Yeah, just for the last few minutes, we thought it'd be really interesting to kind of hear from you via some polls that we're going to run. So the first one we're going to run is finding out how you found out about Conquest in the first place. So I don't know, Hannah, you might need to send it to everyone.
So that should be live now. Just give it a few seconds while people are trickling in. Okay, I think we've got nearly everyone. So I'm going to end it there.
So yeah, it looks like that most of you found out about Conquest via email, which is really useful for us to know, because we'll be hoping to do another round of kind of promotion to new students that are arriving in September. So that's really helpful. We'll just do one more poll. I can't.
Which one did you want, Emily?
We can do how often are you likely to complete Conquest, number 2.
Okay, it's open again now. We're at 80% now, so as most of you. Great, I'm just going to stop that there.
Great, that's really helpful to know. Yeah, thank you so much for having participated so regularly and completing it. And yeah, thank you very much. That's really encouraging to see that most of you are hoping to complete it regularly in the future. I think we'll finish up there now, but yeah, just wanted to say again, thank you so much, and do get in contact if you have any questions or suggestions for us. And thank you to all of the panelists as well. And also just to mention that we do have a publication, we sent out the link to that in an email yesterday that's just been released in Scientific Reports based on the Conquest data, and we've got a couple of others that are preprints and in press, so we'll keep you informed, because that's one of the things the focus group that came up in that was that you'd like to know more about the results from Conquest. And also, if you weren't aware of the website, that we have a website which the link to that is in every email you get from us, so you can look at that, because Adam updates that regularly with the results about the contacts. So yeah, thank you to everybody again, and yeah, thank you, goodbye.